Welcome to our channel MCQ1. In today's topic we will going to cover Nursing MCQ 2024. So let's start the video. Deficiency of nicotinic acids lead to which of the following conditions? Beriberi, night blindness, pellagra, rickets. The correct answer is option C. Deficiency of nicotinic acid leads to pellagra conditions. Bell's palsy primarily affects which of the following? Muscles of the arm, muscles of the leg, muscles on one side of the face, muscles of the neck. The correct answer is option C. Bell's palsy primarily affects muscles on one side of the face. Which vaccine helps to prevent diarrhea in children? MMR vaccine, rotavirus vaccine, hepatitis B vaccine, BCG vaccine. The correct answer is option B. Rotavirus vaccine helps to prevent diarrhea in children. How much cerebrospinal fluid CSF is usually collected during a lumbar puncture for analysis? 1 to 2 ml, 5 to 10 ml, 15 to 20 ml, 25 to 30 ml. The correct answer is option B. 5 to 10 ml cerebrospinal fluid is usually collected during a lumbar puncture for analysis. What is the name of the tiny blood vessels that connect arteries to veins and allow the exchange of oxygen and nutrients? Arterioles, venules, capillaries, alveoli. The correct answer is option C. Capillaries. What is the commonly used IV catheter gauge size for adults? 14 to 16 gauge, 18 to 20 gauge, 22 to 24 gauge, 26 to 28 gauge. The correct answer is option B. 18 to 20 gauge. Which of the following is an early sign of colon cancer? Frequent headaches, blood in the stool, joint pain, shortness of breath. The correct answer is option B. Blood in the stool is an early sign of colon cancer. What is the term for the administration of a drug into the spinal cavity? Intravenous, intramuscular, intrathecal, subcutaneous. The correct answer is option C. Intrathecal is the term for the administration of a drug into the spinal cavity. Which drug is commonly used to treat nausea and vomiting? Paracetamol, omeprazole, ondansetron, amoxicillin. The correct answer is option C. Ondansetron drug is commonly used to treat nausea and vomiting. The ice-pack test is commonly used to diagnose which condition? Myasthenia gravis, multiple sclerosis, Bell's palsy, Turner syndrome. The correct answer is option A. The ice-pack test is commonly used to diagnose myasthenia gravis condition. Plasma cells are formed from which type of cells? T cells, B cells, red blood cells, platelets. The correct answer is option B. Plasma cells are formed from B cells. Which type of diabetes is associated with pregnancy? Type 1 diabetes, type 2 diabetes, gestational diabetes, none of the above. The correct answer is option C. Gestational diabetes is the type of diabetes which is associated with pregnancy. Which of the following manifestations indicate that a client with cirrhosis is developing hepatic encephalopathy? Increased appetite and weight gain, decreased serum ammonia levels, confusion and altered level of consciousness, elevated blood pressure and heart rate. The correct answer is option C. Confusion and altered level of consciousness. What is the recommended rate of chest compressions in CPR for an adult? 60 to 80 compressions per minute, 80 to 100, 100 to 120, 120 to 140. The correct answer is option C. 100 to 120 compressions per minute is the recommended rate of chest compression in CPR for an adult. What is the average weight typically used for pelvic traction? 1 to 2 kg, 2 to 4 kg, 4 to 7 kg, 9 to 11 kg. The correct answer is option B. 2 to 4 kg is the average weight typically used for pelvic traction. At what age does taste perception begin to develop in a baby? At birth, 1 month, 3 months, 6 months. The correct answer is option A, at birth. Which diagnostic test is commonly used for detecting prostate cancer? Mammogram, PSA, bone density scan, colonoscopy. The correct answer is option B, PSA, prostate specific antigen. Gigantism is seen in which of the following conditions? Excessive secretion of insulin, excessive secretion of growth hormone before puberty, deficiency of thyroid hormone in adulthood, low cortisol levels. The correct answer is option B, excessive secretion of growth hormone before puberty. Which neurotransmitter is primarily deficient in Parkinson disease? Serotonin, dopamine, GABA, acetylcholine. The correct answer is option B. Dopamine neurotransmitter is primarily deficient in Parkinson disease. Which class of drugs is used to reduce tremors in Parkinson patient by blocking acetylcholine? Dopamine agonist, anticholinergics, MAO-B inhibitors, none of these. The correct answer is option B. Anticholinergics class of drug is used to reduce tremors in Parkinson patient by blocking acetylcholine. What is the term for the paralysis of both the upper and lower extremities? Hemiplegia, paraplegia, quadriplegia, monoplegia. The correct answer is option C. Quadriplegia. Common symptom of pregnancy during the first trimester is headache, nausea and vomiting, lower back pain, leg cramps. The correct answer is option B, nausea and vomiting. Thanks for watching. Subscribe MCQs 1 for latest informative MCQs.